write it properly. Is it okay? So keep on writing the notes along with me. Okay, fine. And now to start with neuroanatomy part, the basic thing is that each and every student should know one basic thing. Our nervous system is basically divided into two categories. Our nervous system is basically divided into two categories, guys. Someone has not muted their microphone. I request all of you to please recheck and mute the microphone there. You are not only disturbing yourself, disturbing others also. Now to begin with, the very first thing. So guys, I'm now going to start the class right now. See, each and every student, even if you don't know anything in the neuroanatomy, just be with me. I'll make you perfect in neuroanatomy right now, guys. Okay? And I'm going to start from the scratch, from the very basic structure. Okay? So now, remember, our nervous system has been divided into two categories. One will be the central nervous system, and another one will be the peripheral nervous system. Our nervous system has been divided into two categories. One will be the central nervous system and another one will be the peripheral nervous system. Now when it comes to central nervous system, guys, central nervous system will be including two things. Number one, it will consist of brain, and number two, it will consist of the spinal cord. Central nervous system will consist of the brain and the spinal cord. Central nervous system will consist of brain and spinal cord. Perfect. So try to understand here why the doctors gave the name like that. Okay, my brain is exactly in the center here. Okay, now my brain is present inside the cranium, and the spinal cord is found in the vertebral column. So brain and the spinal cord are present exactly in the central axis of the body. The brain and spinal cord are present in the center of the body. That is the reason why doctors have named it as central nervous system. So try to understand with meaning and learn. It will be more better for you. Okay. So doctors ने इसका नाम ऐसे क्यों रखा है? Why they have kept the name like central nervous system, brain and spinal cord. Now from the brain, few nerves are going to begin, and those nerves will go to the periphery of the body. From the brain, few nerves are going to begin, and those nerves are going to periphery of the body. So therefore, these nerves are known as the cranial nerves. So the nerves which are going to begin from the brain are nothing but your cranial nerves, and they are going to the periphery of the body. That is why they are kept under peripheral nervous system. Apart from that, few nerves are going to begin from the spinal cord, and those nerves which are going to begin from the spinal cord, they are known as the spinal nerves. The nerves which are going to begin from the spinal cord are known as the spinal nerves. Okay. So remember, cranial nerves and the spinal nerves, they are going to the periphery of the body. Cranial nerves and the spinal nerves are going to periphery of the body. That is why they are included under peripheral nervous system. Oh my God. Excuse me.
एक दिन दो दिन मेमोग्राफी की डेट है, इसका वो ब्रोशर भी आएगा, मतलब व्हाट्सएप पे वो तो मैं वो
Don't know. Fine. Now, no issues, guys. I'll try to find out that thing. Okay, now I'll just try to set it from my side tomorrow. Now, just concentrate here. So our nervous system is divided into two categories. Okay, like central nervous system and peripheral nervous system. Central nervous system will be including the brain and the spinal cord part here right now, and the peripheral nervous system will include the nerves beginning from the brain and the nerves which are going to begin from the spinal cord. So the cranial nerves and the spinal nerves. Fine. Now once you're comfortable with this one, guys, now let us go towards the number. Now let's see the number right now, guys. How many cranial nerves do we have? Like we have got like 12 pairs of cranial nerves, and we have got like 31 pairs of spinal nerves. 12 pairs of cranial nerves and 31 pairs of spinal nerves. Okay. Someone is writing on the screen there. Please don't write on the screen. Someone is writing on the screen. Please don't write on the screen there. Try to remove that. So nervous system is basically divided into two categories, guys: central nervous system and the peripheral nervous system. Central nervous system will include the brain and the spinal cord, and the peripheral nervous system will be including the cranial nerves and spinal nerves. Now out of this 31 pairs of the spinal nerves, guys, all the 31 pairs of the spinal nerves, they are in turn divided based on the region. They are divided into, like, cervical. In the neck region we are having cervical spinal nerves, and in the thorax region we'll be having thoracic spinal nerves, and then we'll be having lumbar, and then sacral, and then coccygeal. Okay. So all the 31 pairs of the spinal nerves are in turn divided based on the region into cervical, thoracic, lumbar, sacral, and coccygeal. Is it okay? So out of them, let us just write down here, sir: spinal nerves, cervical spinal nerves, then we'll be having the thoracic spinal nerves, and then you have got the lumbar spinal nerves, and then sacral spinal nerves, and then coccygeal spinal nerves. Fine. So all these 31 pairs of the spinal nerves are in turn divided into, the cervical, thoracic, lumbar, sacral, and coccygeal. Now out of these 31 pairs, how many will be the cervical spinal nerves? There will be totally 8 pairs. There will be 8 pairs of cervical, and then there will be 12 pairs of thoracic. Then there will be 5 pairs of lumbar, 5 pair of sacral, and 1 pair of coccygeal, guys. Okay. So I repeat once more here right now. There will be 8 pairs of cervical spinal nerves, 12 pairs of thoracic, and then 5 pairs of lumbar, 5 pair of sacral, and 1 pair of coccygeal. If you just add them, 8 plus 12 will be 20, plus 5 will be 25, plus 5 will be 30, plus 1, 31 pairs. Is it okay? So this is like the basic thing that each and every doctor should know. Each and every student should know. Okay. Central nervous system will include the brain and the spinal cord, and the peripheral nervous system will include the cranial nerve and the spinal nerves. There will be totally 12 pairs of the cranial nerves, and there will be 31 pairs of the spinal nerves. Done. Now once you know about this one, first of all, let's begin from the scratch, from the basics. Okay, first let us learn about the brain and the spinal cord, guys. Okay, that is about our central nervous system. So what I'm going to do here is that I'm going to actually teach you from the scratch. So सबसे पहले मैं आपको ना basics terminology पढ़ाऊंगा. I'm going to teach you the basic terminology. I request someone has put these lines on the screen. Please erase. It will not be erased from my side. Please erase them. Whoever has marked this line on the screen, please erase them. Now first we are going to start with the central nervous system. So first let's begin with the brain right now, guys. Yes. Try to guess yourself. Can anyone guess and tell me? Can anyone tell me the another name of the brain? What is the medical terminology of the brain? What's the name of the brain? Please don't put the line on the screen, guys. It's actually a dual sharing screen. We both can, write on that one. Please remove the other lines also. Whoever has marked that. Brain is also known as encephalon. Very good. Very nice. Brain is also known as encephalon. Okay, that is another name of the brain. And now do one thing, guys. Draw along with me. This will be the brain here right now, and this will be the spinal cord. This is the schematic.
अरे भाई अपना बंद करो यार, ये सिस्टम म्यूट करो ना.
Now draw the diagram along with me, guys. This is schematic diagram of the brain and the spinal cord. Schematic diagram of the brain and the spinal cord here right now, guys. Okay. तो चलिए पहले हम लोग ना सब लोग आराम से ना पहले इसके नाम सीखते हैं. लेट अस ट्राई टू लर्न द नेम्स. ओके, हम सबको बताया है कि ब्रेन विल बी हैविंग लाइक 3 पार्ट. दिस विल बी द फोर ब्रेन, एंड दिस हियर विल बी द मिड ब्रेन, एंड दिस वन हियर विल बी द हाइंड ब्रेन. है ना यार, ये तो सबको पता है. एवरीवन नोज दिस वन, है ना. वी नीड टू लर्न द मेडिकल टर्मिनोलॉजी नाउ. ओके, so what is the another name that is given for the forebrain there? Forebrain is also known as prosencephalon. Forebrain is also known as prosencephalon. Okay, and similarly the midbrain is also known as mesencephalon. Guys, I want you to write down along with me. Okay, and while writing, okay now please be sincere to yourself यार. कोई देखने वाला तो है नहीं, अपने को पढ़ाई करना है, अपने को एग्जाम में लिखना है. We have to write down the exam, so please be sincere to yourself. Write down the notes, लिखते जाओ मेरे साथ में, and at the same time keep on learning the names. Okay, slowly I'll teach you all the complicated topics like basal ganglia and all those things, Brodmann areas and all. तो उन सारे complicated topics को पढ़ने के लिए पहले ना basics strong होनी चाहिए. We need to have our basics very clear. ठीक है, so please write down the name and keep on learning the name in your mind. Is it okay? So forebrain is also known as prosencephalon, midbrain is also known as mesencephalon, whereas the hindbrain is also known as rhombencephalon. अगर आप ध्यान से देखोगे, if you are observing carefully there, each and every name has got encephalon. It's like you have to remember prosen, mesen and rhomben. Fine. So brain is divided into 3 parts: the prosencephalon, mesencephalon and the rhombencephalon. Now once you are comfortable with this one, let's go into more depth right now. Let's go in depth right now. Fine. Now our forebrain is in turn made up of 2 parts. Number 1, this big part that you're able to see here is your cerebrum. Okay, and located deep inside the cerebrum के अंदर, you're not able to see this from outside. Okay, and this is actually the diencephalon. So this big part here will be the cerebrum, and located inside will be the diencephalon. And from today onwards, guys, remember these 2 parts together, cerebrum and diencephalon, these 2 parts together are said to be the, are forming the forebrain. So a forebrain will be actually formed by 2 parts, that is the cerebrum part and along with that the diencephalon part, sir. Cerebrum and the diencephalon wala part. Okay. Now guys, similarly try to guess here, what is another name given for cerebrum? Cerebrum is also known as telencephalon. Cerebrum is also known as telencephalon. Cerebrum is also known as the telencephalon, guys. And what about the diencephalon? I hope you have heard about thalamus, hypothalamus, subthalamus. So whatever thalami you have heard, okay, now all the thalami together, jitne bhi sare thalami parts hai, all thalami together, they are going to form your diencephalon. So basically diencephalon is made up of all your thalami part. Diencephalon is made up of all your thalami parts. Okay, fine here right now. So forebrain is actually made up of 2 parts. Let us just revise once and finish it off. Forebrain is made up of 2 parts, cerebrum and diencephalon. Cerebrum is also known as telencephalon, and diencephalon will include all your thalami parts. सारे thalami मिलकर diencephalon form करते हैं. Thalamus, hypothalamus, subthalamus, everything. And now after that, welcome to the midbrain here right now, guys. Midbrain, thank God, it's not yet divided. Is it okay? Midbrain is just midbrain. Is it okay? So midbrain is not further divided, thank God. And now welcome to the hindbrain here right now, guys. Now in the hindbrain, there are actually 3 parts here right now. Number 1 part that you are able to see in the front here, this will be actually the pons. And this part here will be the medulla oblongata, or simply medulla. And remember guys, pons and medulla will be in the front. Pons and medulla will be in the front, okay, now ventral aspect of the brain. And behind the pons and medulla here, this part here, this will be the cerebellum part. So behind the pons and medulla, this will be cerebellum. Fine. So remember, pons, medulla and cerebellum, these 3 parts together is said to be your hindbrain. They are forming a hindbrain. Now the most important thing, I want you to be like more alert right now. There is a point to be getting confused here. This pons in the front here right now, and this cerebellum behind. Okay, there will be pons in the front here and cerebellum behind. Remember these 2 together, pons and cerebellum, these 2 together, it is said to be the मेटेनसेफेलॉन, इसको हम कहते हैं मेटेनसेफेलॉन. एंड मेडुला ऑब्लोंगेटा अलोन इज सेड टू बी द माइलेनसेफेलॉन. माइलेनसेफेलॉन. Fine. So guys, remember the pons, medulla and the cerebellum, there are three parts actually, and out of these three parts, okay, pons and cerebellum together, the pons and cerebellum, these two together, they are said to be metencephalon, and medulla oblongata alone will be the myelencephalon. Okay. And finally, each and every one student knows that the medulla oblongata will continue down into the spinal cord. Medulla oblongata will continue down to the spinal cord, guys. Fine. So this is the basic thing that we need to start with the neuroanatomy. I think इतना basic से हम लोग start करें. We are starting from so much basics, okay, so that you know everyone should be able to understand that one, guys. Okay, so try to take the advantage of these classes here right now, guys, and try to learn them along with me from the very scratch, from the very beginning. चलिए एक बार हम लोग ना मिलकर, okay, you people say from your side and I'll be saying from my side here right now, guys. चलो try to recall the names right now. Brain is also known as what? Encephalon. And our brain is actually divided into three parts: the forebrain, midbrain, and the hindbrain wala part. The forebrain is also known as prosencephalon, and the midbrain is also known as mesencephalon, and the hindbrain is also known as rhombencephalon. Okay? And the forebrain is in turn made up of two parts: the cerebrum and diencephalon. And remember, cerebrum is also said to be the telencephalon. Diencephalon will include all the thalami parts. And mesencephalon is just mesencephalon, it's not further divided. And welcome to the hindbrain, rhombencephalon. It is made up of three parts: the pons, medulla, and cerebellum part. And out of these three parts, the pons and cerebellum, these two together are going to form your metencephalon, and medulla oblongata alone is going to form your myelencephalon. Fine here right now. Now, once you all are comfortable with this terminology, once you are perfect with this terminology, now let me show you the same diagram of the brain and the spinal cord in another section. Okay, I hope every one of you know that. Okay, this diagram of the brain is actually in sagittal section, guys. Guys, what is the meaning of sagittal section? Sagittal section का मतलब क्या होता है यहाँ पर? Sagittal section means I am going to cut my body exactly from the middle. Okay, try to look at me here right now, guys. Stop writing, everyone. Okay, see, don't panic. Many of you were asking me on the messages, okay, sir, what about the notes? Will be able to write down the notes or not? Don't worry at all, guys. You will be able to you know write down the notes along with me. मैं exactly I'm going to teach you in the same manner as I will normally teach in my classes. ठीक है, जैसे मैं normal class में पढ़ाता हूँ, बिल्कुल वैसे आराम से. I'll give you time for writing. I'll write along with you. आप देख ही रहे हो, आप यहाँ पर देख रहे हो कि मैं आपके साथ में लिख रहा हूँ. So I'm going to write along with you, draw along with you. तो कोई दिक्कत वाली बात नहीं, आराम से notes लिखते जाइए. And if I'm showing you any images, all those images I'll send you in the WhatsApp group after the class. Is it okay? So don't panic, बड़े आराम से coolly पढ़ते जाइए. And we are having a lot of time. समय का हमको ना दिक्कत कोई नहीं है, तो आराम से सर लिखते जाओ. And please, one last and final request, guys, try to cooperate with me. I'm just trying to come for you people, you know, online, so that you know it. अगर हम if you see in one way, it's almost like studying one to one. Okay, it's like one on one instead of learning in like big classes with, you know, hundreds of students and all those. Someone is doing something on the screen. That's what I'm telling you. Please try to cooperate with me. Don't try to do all these things, guys. So this is the first day. All these things, you know, we are trying to see okay, what are the problems coming in on. So please try to cooperate. It will be more better for you only. I can help you as much as you want. Okay. किसी ने अभी screen पर लिखा है. Someone has written on the screen. Please try to erase that because it will not be erased from my side. I think it will be a trouble for everyone. Please erase those lines on the screen. Now. Now guys, once you are comfortable with this, you know, the sagittal section of the brain, once you are comfortable with the sagittal section of the brain here, cutting the brain exactly in the middle. So this diagram of the brain in the spinal cord is like, you know, we are going to cut exactly in the middle here right now. I'm going to cut my body exactly in the middle. And then the right half and the left half Okay, we are going to divide in this plane, the right half and the left half, and this plane is said to be the sagittal plane. What is the name of the plane? Sagittal plane. Fine. So sagittal plane, we are going to cut the brain exactly in the middle, and then we are seeing from side. अगर आप side से देखोगे in the sagittal plane, this is how the diagram looks like exactly on your screen. This is how it is looking like. ठीक है ना? Now I want to see the brain from the front, right from the front. So okay, so I'm going to cut my brain exactly in coronal section ऐसे, dividing the brain into anterior half and the posterior half. Okay, so I'm going to cut my brain in this manner, and that plane is said to be the coronal plane. Okay, so let me just show you how the coronal plane looks like. So this will be the brain and the spinal cord in sagittal section. This will be the brain and the spinal cord in sagittal section. I'm now going to cut in this plane, that is a coronal plane. And after cutting in that coronal plane, we are going to remove everything from the front and look at it from the front. Okay, let's look at the brain from the front. हम इसको देखेंगे सामने से, ठीक है? So if you look at the brain from the front, let's draw the diagram together. चलिए हम लोग ना मिलकर diagram draw करते हैं. You try to correlate all these structures right now, guys. So this will be the cerebral hemisphere. Okay, this big part here is nothing but the cerebral hemisphere, and this will be the cerebral hemispheres right now. And now because we are looking from the front, now you're able to see both the cerebral hemispheres. And located deep inside the cerebral hemisphere will be the diencephalon. So this will be the cerebral hemispheres, and yeah, you have to draw the diagram, damn it. This is the cerebral hemisphere, and located deep inside the cerebral hemisphere will be diencephalon. Now try to recall from the previous diagram. This together, that is your cerebral hemisphere and diencephalon, these two together are going to form your forebrain. क्या form करेंगे? Forebrain. Right? Now after this forebrain, the next part will be the midbrain. So imagine this one to be your midbrain. Fine. Now after this midbrain here, the next part here will be your pons here right now, guys. And after that pons, this part will be here, the medulla oblongata here. And this medulla oblongata will actually continue down to the spinal cord. Okay, so this will be the cerebral hemisphere, this will be diencephalon here, and then this will be the midbrain. अगर आप ध्यान से देखोगे, if you observe properly here, I have just drawn only the pons and the medulla here. Okay, now where is the cerebellum? Cerebellum कहाँ पर है? Where do you have cerebellum, guys? Cerebellum is actually behind the pons and medulla, and because we are looking at the brain from the front here right now, so because we are having the cerebellum behind, you will not be able to see or find the cerebellum in this diagram. So I repeat just once more here right now, if you have not understood this one. Cerebellum will be actually present behind the pons and medulla. So when you are looking from the front, अगर आप आगे से देख रहे हो तो आपको सिर्फ pons और medulla नजर आएगा, और cerebellum कहाँ पर होगा? पीछे. And we all know that जो चीज़ें पीछे होती है वो आगे से नजर नहीं आती है ना? तो you know that very well rather than me. So try to understand this one very quickly. Now my dear friends, on the screen you are able to see two diagrams here. One diagram of the brain will be in the sagittal section here right now. Another diagram of the brain will be in the coronal section. एक हम लोग ना side से देख रहे हैं, we are looking from side, and one we are looking from the front here right now. And believe me, trust me, in the entire neuroanatomy, I am going to make you draw the hand-drawn diagrams. In the entire neuroanatomy, I am going to make you draw the hand-drawn diagrams. And all your neuroanatomy will be completed only and only by these two diagrams that you are able to see on the screen, sir. One in sagittal section and one in the coronal section. So with the help of these two diagrams, I'll try to cover the entire neuroanatomy part. So don't worry about that. So first, starting 5-10 minutes here, you have to be comfortable or become comfortable with these diagrams. Why? Because these diagrams are going to come again and again and again and again. Is it okay? Fine here. So that's all. So once you're perfect with these two diagrams, done, sir. So please don't write on the screen. Who is doing that? Remove that. Please write in your notes, not on the screen. And I can't remove this from here, from my side. Please remove that. Who has done that? Please remove that. Yeah. Next one. Now once you are done comfortable with these two diagrams here right now guys, now let's get started with the first topic right now, that is about the ventricles of the brain. So I'll do one thing here, I'll try to draw this in the same diagram here right now. So I think you have drawn this diagram a little bit bigger. Ventricles of brain. Now this is one of the most important topic for your FMGE MC exams. They have a lot of time ask these questions guys. So welcome here right now. In the ventricles of the brain, first of all you'll be able to find one ventricle over here and another ventricle over here in the cerebral hemisphere. Now what is the name of this ventricle? It will be known as the lateral ventricles. Please keep on writing the notes along with me and keep on drawing the diagram. आपको ना दो जगह पर नजर रखना होगा. You have to learn two things here right now. Number one, what is the name of the ventricle? Lateral ventricle. And what is the location of the ventricle? Yes, it is located in the cerebral hemisphere. Fine. Name of the ventricle and the location of the ventricle. So what is the name of the ventricle? Lateral ventricle. And what is the location of that one? Yes, it is present in the cerebral hemisphere. Perfect. So it is very easy from our diagram. Now after these two lateral ventricles here, the next one will be the third ventricle here guys. So this will be the third ventricle here. And I think the moment you look at this diagram, you are easily able to identify that third ventricle is located in diencephalon. The third ventricle is located in diencephalon. And once you are done with that one, the next ventricle will be in the pons as well as the medulla oblongata. The pons and medulla oblongata. Not only pons and medulla oblongata, the ventricle is also going to extend behind into cerebellum. Not only in this pons and medulla oblongata, it is also extending behind piche into cerebellum. So in short, we can say that this ventricle is present in the entire hind brain, in the pons and in the medulla and in the cerebellum also. And this is the fourth ventricle guys. इसको हम कहते हैं fourth ventricle. So basically, where is the fourth ventricle located guys? Fourth ventricle is located in entire hind brain. ठीक है, तो चलिए आपके लिए मैं एक बार और रिपीट करता हूँ. I repeat once more for you people. Lateral ventricles are located in cerebral hemisphere. Third ventricle is located in diencephalon, and the fourth ventricle will be located in the pons and in the medulla oblongata and behind in the cerebellum parts. Okay guys, now do one thing, along with the diagram even write on the notes also. So just below the diagram, please write on the notes, make a small table. On the right hand side, we are going to write down the location of the ventricle. Now, what is the name of the ventricle? First one here, the lateral ventricle. Now, where is the lateral ventricle located, guys? It is located in the telencephalon. Obviously, cerebral hemispheres. Cerebral hemisphere, तो सबको पता है. Everyone knows that. So try to learn the medical terminology. So don't write cerebrum there. Write down telencephalon. Try to learn the medical terminology. The next ventricle here will be the third ventricle. And guys, third ventricle will be actually located in diencephalon. Third ventricle is located in diencephalon. And finally, the next one will be the fourth ventricle. And the fourth ventricle is located in the complete hind brain. And the complete hind brain here will be the rhombencephalon. Rhombencephalon. Okay. So name of the ventricle and the location of the ventricle. Name of the ventricle and the location of the ventricle. Fine. So lateral ventricles are located in telencephalon, third ventricle is located in diencephalon, and fourth ventricle is located in rhombencephalon. Now once you are done with the notes, again welcome back to diagram guys. अब हम क्या करेंगे, इन ventricles को जोड़ेंगे. Let's join the ventricles together. Fine. Now these two lateral ventricles are joined together with the help of a opening here. And whenever in anatomy you have an opening here, opening is known as what guys? Foramen. And this is known as very famously the foramen of Monro. इसको हम कहते हैं foramen of Monro. So remember, what is connecting the lateral ventricles with the third ventricle guys? What is connecting the lateral ventricles with the third ventricle? That is foramen of Monro. And now this third ventricle is connected to the fourth ventricle here, and it is connected to the fourth ventricle with the help of a duct here, and this duct is known as the aqueduct, which is very famously known as the aqueduct of Sylvius. Fine. And the aqueduct of Sylvius, it has got one more name, and it is also known as the cerebral aqueduct. इसको ना हम cerebral aqueduct भी कहते हैं. Aqueduct of Sylvius is also known as cerebral aqueduct. ठीक है. So that is the reason why, so that you can write down the notes along with me. I'm repeating you like 2-3 times, sir. आराम से लिखो. So third ventricle is connected to fourth ventricle with the help of aqueduct of Sylvius. And now finally the fourth ventricle will actually continue down, and it will continue down into the central canal of spinal cord. So this is the central canal of the spinal cord, present in the spinal cord. Fine. Perfect. I think this is the best way to approach this topic. First you are going to learn the ventricles, कि वो कहाँ पर होते हैं, what is the name of the ventricle and location, and then after that join them together. ठीक है ना, उनको जोड़ दो, बड़ा सिंपल है. ठीक है. चलिए सर एक बार हम लोग मिलकर रिवाइज करते हैं साथ में. Lateral ventricles are located in cerebral hemisphere. Third ventricle is located in diencephalon, and the fourth ventricle is located in the entire hindbrain, dorsal. Third, lateral ventricle are connected to third with the help of foramen of Monro. Third is connected to fourth with the help of aqueduct of Sylvius, and the fourth one will continue down to central canal of the spinal cord, guys. Hope everything is clear till here. Okay. So this is like, you know, the important things to be learned about the ventricles of the brain, guys. Now once you are done about the ventricles of the brain, my dear friends, what do you have inside these ventricles of the brain, guys? What do you have inside the ventricles of the brain here right now? If you have become a little bit comfortable, try interacting with me. You know, we'll just do all the experiments today. If you're comfortable with me right now, try to write down in the, you know, that chat box over there. Lovely. Yeah. So inside these ventricles, you'll right now is the CSF. So please write on the heading now as the CSF, the cerebrospinal fluid, guys. So we are done with the ventricles of the brain and how they are connected now. Now the next topic is CSF, cerebrospinal fluid. Very good Pranshu Gupta, very good Divij. It is CSF. Now in the CSF we have to remember like few points for your FMG exam. Point number 1 you have to remember is, yes, first of all, formation. ये CSF form कहाँ से होता है? We all have been learning from school days. CSF will be formed from the choroid plexus. CSF will be formed from the choroid plexus. And now let's have a discussion here. Now what is the meaning of plexus, guys? Plexus का मतलब क्या होता है? Plexus means what? Network. Now choroid plexus का मतलब क्या होता है? What is the meaning of choroid plexus? Remember, choroid plexus is nothing but the network of capillaries. Choroid plexus is network of capillaries. Now if it is network of capillaries, थोड़ा सा दिमाग लगाओ, सोचो, think about that one. What will happen in the capillaries? Capillaries में क्या होता है? Blood is going to flow into that term. Artery, arteriole, capillary. Capillary में क्या होगा? Blood आएगा. Now once the blood will come into the capillaries, from those capillaries the blood will be filtered. We all know in the capillaries what will happen? Filtration will take place. And once the blood is getting filtered into that one in the capillaries, okay, network of capillaries. Now after filtration के बाद whatever fluid you are going to get, that fluid is nothing but the cerebrospinal fluid. So cerebrospinal fluid is nothing but obtained from the blood itself. The blood will get filtered, and after filtration will be getting there. Now that filtration is taking place in the choroid plexus. Chalo, next one. Point number 2. What is the normal volume of CSF? Remember, it is 150 ml. Normal volume of CSF will be 150 ml. 150 ml. Now once you are done with that, yeah, the most important point, how much amount of the CSF will be formed per day? Per day, it will be almost like 500 to 600 ml. 500 to 600 ml of CSF is formed per day. Per day, 24 hours. Most of the students I have seen, they'll just remember the numbers 500. Please remember the units also. It is 500 to 600 ml per day. ml per day. Fine. Now the most important thing is, out of this 500 to 600 ml per day, how much amount of the CSF will be drained per day? कितना drained हो जाता है? Can anyone help me? How much amount of the CSF will be drained per day? Yes. Remember, exactly the same, almost like 500 to 600 ml of the CSF will be drained per day. Are you getting me? So this is like something important here right now. In most of the classes wherever I take, the students are confused about this one. Sir, if 500 ml is forming and then 500 ml is draining, then how come you have got the 150 ml? ये 150 ml कैसे होता है ना? तो थोड़े लोगों के बीच में दिमाग में ना ये डाउट होता है कि अगर 500 फॉर्म हो रहा है और 500 ट्रेन हो रहा है तो 150 कैसे? Guys, try to remember, I told you very clearly, okay, very clearly that what is the normal volume of CSF always present in the ventricle? हमेशा कितना होता है? 150 ml. In that 150 ml of CSF in a day, that is 24 hours, what is going to happen? You know, slowly CSF add होता है and slowly CSF drain होता है. I did not tell you any time that at a time 500 ml of CSF will be formed. एक साथ नहीं फॉर्म होता है. 500 ml of CSF will be formed and 500 ml of CSF will be drained in a span of one day, one whole day. That is 24 hours. You know, step by step. Is it okay? Rashid, I'm coming to your question. Okay, don't worry. So I hope you will are learning. Don't just keep on copying, sir. Keep on learning also. Formation of CSF will be taking place from choroid plexus. Plexus means network of capillaries. Normal volume of CSF 150 ml. How much is formed? 500 ml. How much is drained? 500 ml will be drained per day. Okay. And now welcome to the most important thing, that is a course. So please write down the next side heading as course. Let's see CSF कैसे travel होता है. ठीक है. See, most of the CSF will be formed in the lateral ventricles. Okay, G. From the lateral ventricle, the CSF will go into third ventricle. कैसे? How? Via the foramen of Monro. Okay guys, I think this is like becoming easier for you right now क्योंकि आपने अभी इसका diagram draw किया है. Already you have learned the anatomy part of that one. So from the lateral ventricle, the CSF will go to the third ventricle via foramen of Monro. Now from the third ventricle, the CSF will go to the fourth ventricle. And how is it going to the fourth ventricle? Via the aqueduct of Sylvius. Aqueduct of Sylvius, also known as cerebral aqueduct. Perfect. And if you have written the flow chart till here, okay, just stop, don't write anything after that. Now please do one thing guys, please welcome back to this diagram. Hope you have drawn this diagram. आपने draw किया होगा. So please welcome back to this diagram here guys. Now my dear friends, most of the CSF will be formed where? Only in the lateral ventricle. From the lateral ventricle, CSF is going to third ventricle. From the lateral ventricle, CSF is going to third ventricle. Okay, कैसे? How? Foramen of Monro. And from the third ventricle, the CSF will be going through aqueduct. Via aqueduct, it will go to the fourth ventricle. And from the fourth ventricle, the CSF has to actually come down into the central canal. Now coming to one of our friends question here. Rashid has asked one question कि CSF से drain कहाँ पर होता है. Now listen carefully. Now comes your answer guys. Now I request all of you to please listen this part very carefully right now. See, every one of us as a medical student, we all know if you follow downwards, the spinal cord will be finally closed. Spinal cord क्या होता है? Finally क्या होता है? Close हो जाता है. Now obviously everyone will get a doubt कि सर से CSF drain कहाँ से होता है? From where is the CSF then draining then? If you follow downwards, if you move downwards, spinal cord तो close हो जाता है. Then CSF drain कहाँ से होता है? And now my dear friends, add into your diagram right now. On the lateral side of the fourth ventricle, you'll be having like two openings. And this will be known as the foramen of Lashka. Foramen of Lashka. So on the lateral side, we'll be having two openings in the fourth ventricle. Okay, where are we right now? We are in the fourth ventricle. So on the lateral side, we'll be having foramen of Lashka. And in the midline here, you'll be having a foramen, and that foramen is known as the foramen of Magendie. Or some people love to call it as Magendie. Magendie bolo ya Magendie bolo, whatever you say, try to remember. Okay, na? The ultimate thing for FMG, remember that. So in the fourth ventricle, you have got two foramens on the lateral side. Remember like this: L for lateral, L for Lashka. And in the midline, okay, you'll be having one more foramen, and that is M for midline and M for Magendie. Is it okay? So L for lateral, L for लश्का, M for midline, M for megendry. चलो, अगर आपने इसके नाम सीख लिए हैं, if you have learned the names here right now, guys, now, yes, what is the use of this one? Whatever CSF is coming in the fourth ventricle, from the fourth ventricle, the CSF is going to move out, okay, via the foramen of lashka and foramen of megendry, it's going to move out. Okay, fine. So what we will do right now is that we will also try to move out along with that one. We'll also try to move out along with the CSF out. चलिए. Now the moment you come out of the brain, जैसे आप बाहर आते हो, the moment you come out of the brain, now again one more problem. What is the problem right now? Our brain and the spinal cord, we all know that it is covered by 3 meninges. Our brain and the spinal cord are covered by 3 meninges. So try to recall, guys. Okay, right now I am not right in front of you so that I can ask you the questions. So try to recall in your mind itself. How many meninges do you have, guys? Yes, 3 meninges. And the 3 meninges will be the dura mater, arachnoid mater and the pia mater. Dura mater, arachnoid mater and the pia mater. है ना? Now everyone do one thing, completely stop writing. See, follow my instructions whenever I'm telling you guys, okay? I'm not that kind of faculty के मतलब लिखते जाओ. No writing, you have to learn. यहाँ जाना चाहिए, okay ना? आराम से पढ़ो. So no need to just rush. आराम से, ठीक है ना? So whenever I'm telling you, please stop writing and look at me. You have to look at me. Is it okay? So now how many meninges do you have, guys? 3 meninges. Dura mater, arachnoid mater and the pia mater. ठीक है जी? Now outermost meninge will be dura. Look at my hands here right now. Outermost meninge will be dura. Then middle one will be arachnoid and the innermost one will be pia mater. If you are finding difficulty, sir, how to remember, the best way, remember in Hindi. Hope आप सब लोग को ना थोड़ी बहुत हिंदी तो आती होगी. I hope you know little bit of हिंदी, कंचम. तो the outermost meninge, सबसे दूर जो होता है, is dura mater. The outermost meninge, सबसे दूर जो होता है, dura mater. And the middle one here will be the arachnoid mater. और सबसे पास जो होता है वो होता है pia mater. ठीक है? And don't call it as pia, call it as pia. You know हिंदी में pia किसे कहते हैं? मेरे ख्याल से मुझसे ज़्यादा आपको पता होगा. pia बहुत पास होता है. So सबसे पास जो होता है, okay, the innermost meninge will be the pia mater. ठीक है? So keeping this in mind, I think you will never get confused. Okay? चलो let's draw. The outermost meninge here will be dura mater. The middle one here will be arachnoid mater and the innermost meninge here will be the pia mater, which is very much close to the brain. There is no place there. And now my dear friends, please look at my screen here right now. Between the dura mater and arachnoid mater, we are able to find some space here and that is known as subdural space. Subdural space. It makes some sense. Common sense वाली बात है ना? Like subdural, below the dura mater, dura के नीचे. And then between the arachnoid space, इसे हम क्या? So between the dura and the arachnoid there will be subdural space, and between the arachnoid and the pia mater there will be subarachnoid space. And next one, between the pia mater and the brain you don't have any space at all, and that is the reason why our mnemonic goes very well. पिया इतना पास होता है कि दरमियान में जगह नहीं होती है. There is no place between the pia mater and the brain. ठीक है जी? So that is the best way to remember. And now my dear friends, चलो, you only guess right now. You people guess right now. Come on. Don't wait for me. Try to think like a doctor. Now the moment the CSF is going to come out, जैसे CSF यहाँ से CSF is going to come out, it has to come out where only? In the subarachnoid space. It makes some sense now. So therefore our CSF will come out where into the subarachnoid space. Okay ji. So from today onwards, each and every student knows that inside the brain, where do you have CSF? We have inside the ventricles and all. But where do you have the CSF outside the brain? Brain के बाहर कहाँ होता है? Yes, it is present in the subarachnoid space. Okay, it makes some sense now, है ना? So after writing everything in the diagram here, welcome back. हम ना simultaneously notes भी लिखते हैं. Diagram हो गया है. And now next we are going to write on the notes also. So where are we in the flow chart? Fourth ventricle. From the fourth ventricle, CSF is moving out into arachnoid space. And how is it moving out into the subarachnoid space? Via the foramen of Lashka and foramen of Magendie. ठीक है, foramen of Lashka and Magendie, it is going to come out into the subarachnoid space. Please listen from here. Here you'll be having, you know, finger-like projections known as villi, arachnoid villi. This thing I did not teach you till now, so please try to learn it now. Villi, finger-like projections from the arachnoid matter, arachnoid villi. And now these arachnoid villi are going to reabsorb the CSF and drain. They are going to reabsorb the CSF and drain. And they are going to drain the CSF into the dural venous sinuses. We are going, the CSF is going to be drained into the dural venous sinuses. Okay, fine. Now guys, today you don't worry about what is this dural venous sinuses, don't worry about that. It's a big topic. We are going to study about the dural venous sinus in head and neck topic. Our next topic, head and neck topic में पढ़ेंगे हम बाद में, ठीक है? अभी के लिए what you do is, you just concentrate on this word venous. अच्छा. Why? Why? Because our CSF is finally going where only? Into the blood. Which blood? Venous blood. तो today it makes some sense guys कि CSF form कहाँ से होता है? CSF is forming from where? Choroid plexus. And what is choroid plexus? Nothing but network of capillaries. So CSF is forming from where only? From the blood. And finally the CSF is going to drain in the blood itself. Understanding? So our concept becomes 100% complete today, that CSF is forming from blood and it is actually draining into the blood cell. तो कोरोइड प्लेक्सस से फॉर्म होता है, ब्लड से फॉर्म होता है. इट इज गोइंग टू ट्रैवल फ्रॉम द लेटरल वेंट्रिकल, फोरामेन ऑफ मॉनरो, थर्ड वेंट्रिकल, एक्विडक्ट, फोर्थ वेंट्रिकल, एंड देन फ्रॉम देयर इनटू सबएरेक्नॉइड स्पेस, एंड फिर वहां से क्या हो जाएगा? ड्रेन हो जाएगा. इट इज गोइंग टू ड्रेन इनटू द ड्यूरल वीनस साइनसेस. आर यू कंफर्टेबल विद दिस वन हियर राइट नाउ? एंड दैट कंप्लीट्स अवर this topic here right now. And Dr. Demon is actually asking what is the importance of CSF. Guys, CSF is actually going to help you in maintaining the buoyancy of the brain and all. Normally brain is like 1.5 kg, but are you able to feel that 1.5 kg here in the head? No, head is very much lighter, so it provides buoyancy and all those things. There are many functions of that. You will learn the functions in physiology part. Don't worry about that. Is it okay right now? And now if you see in your books, I am done with the basic terminology of the brain, and then about the ventricles and a small topic that is CSF. And believe me, trust me, this is just the trailer of the neuroanatomy. We are done with that. So we are done with one complete segment of the neuroanatomy. एक part हो चुका है basics. अब यहाँ से step 2. We are going to go to a little bit, a complicated topic. So I will do one thing here. Same like my classes. I'll just give you like 1 minute of break right now, guys. Don't disturb yourself. Don't go anywhere right now. Just turn the pages and see everything whatever you have done. Okay, whatever we have completed till now. Try to just revise quickly. Someone wanted the explanation of arachnoid villi is actually, you have got arachnoid matter. Arachnoid matter will actually form the finger-like projections. Villi, I think you have studied about the villi and the intestines and all. So they're like finger-like projections like this. But here it is made up of your second meninge, that is the arachnoid matter. Okay? Next one. First CSF formed by amniotic fluid and all those things that we'll see in the embryology part. Don't worry about that. चलो आगे बढ़ते हैं. Shall we go ahead right now? I think everyone is comfortable till here, guys. Just do one thing, just few of you please send me some yes or no messages. I think everyone is comfortable right now till here. I think everything is set right now till here, है ना, सब कुछ set है. That's perfect, perfect, perfect. Thank you, excellent. Yes sir, yes sir, yep sir. Thank you all. Okay, fine. तो मैं कह रहा था ना sir, like you know every new thing will obviously have some disturbances. Is it okay? My basic motto of coming down online for you people so that I can help you, like you know, one to one here right now. So please, the more you cooperate with me, the more I can help you out. Okay, I'm always there for you. Perfect, perfect Vikram, perfect Subhashan, best Vikram, yes sir, iPhone, yes sir, thank you all. चलो अब हम बढ़ते हैं आगे. Once we are comfortably done with the basics, see again someone is writing on the screen, please yeah, I'm telling you, please cooperate with me quickly and I can cooperate with you more quickly. Now once you are done with all these basics, guys, basics are done here right now, and now let's start with one of the important topic. Heading likho sir, spinal cord right now. Okay, and now let's begin with the spinal cord. Today we'll finish the spinal cord. Many questions are coming from this spinal cord topic in FMG, in MC exams, so please listen here very carefully. See, I'll tell you one thing. I'm going to teach you in this manner. Guys, don't draw this. Just look on the screen here right now. I'm going to start from below here, from the spinal cord. And slowly from the spinal cord, we are going to move up. Then we'll study medulla oblongata, pons, midbrain, and then diencephalon, the basal ganglia, the Brodmann areas. So slowly I'm going to teach you entire neuroanatomy, each and every topic, starting from below. Spinal cord se start karke. ठीक है जी? So just keep on following all my topics in order. Okay, so now let's get started with the spinal cord topic. So first of all, let us see the external features of the spinal cord, guys. Let's see the external features of the spinal cord. External features, है ना? Spinal cord को हम बाहर से देखते हैं. First of all, the most important thing is the extent of the spinal cord. This is extremely important for MCI. स्पाइनल कॉर्ड कहाँ से कहाँ तक होता है? स्पाइनल कॉर्ड इज फ्रॉम वेयर टू वेयर. नाउ बिफोर आई टीच यू पीपल, कैन यू पीपल हेल्प मी गाइस? कैन यू जस्ट पोस्ट योर आंसर्स इन द चैट बॉक्स कि स्पाइनल कॉर्ड विल बिगिन फ्रॉम वेयर? कहाँ से बिगिन होता है स्पाइनल कॉर्ड? कैन यू प्लीज टेल मी द आंसर? If some of you have attended my class already, guys, I request you, please, if you have my old notes or somewhere from the notes, close the notes and try to keep on answering me without seeing. See, basically it will help you only, है ना? If you close the note and keep on answering me, that will build up your confidence so that you are telling without seeing. If you just see and tell, that doesn't make any difference. It's waste of that thing. Okay, I'm getting so many answers here right now. Okay, चलो यहाँ देखो सर. That is why I asked this question, guys. See, many of you have answered here right now, and so many answers are like different answers. Someone is saying C1, someone is saying T12, and someone is telling ending of the hindbrain, then medulla and all. Listen. From today onwards, please learn it properly as it is given in the Gray's Anatomy. Exactly. Our spinal cord is going to begin from C1, the first cervical vertebra. It's not your problem. I have seen in the lower, standard books, 11th and 12th standard books, in science books and all, in our school days, what we have learned, they have taught us wrongly. In our lower standard books, they have taught the spinal cord is beginning from foramen magnum. It's absolutely wrong, bullshit. It's given very clearly in Gray's Anatomy. Gray's Anatomy में बहुत clearly दिया गया है. Look at me here right now. If this is the opening, that is foramen magnum. Still what is happening? Medulla oblongata is passing. After passing through the foramen magnum, medulla oblongata, okay, foramen magnum, medulla oblongata, after passing through that, then it is going to become your spinal cord from the first cervical vertebra, C1. So from today onwards, if you have anything wrong in your mind, cervical vertebra. And right from first cervical vertebra, the spinal cord will be extending up to the first lumbar vertebra, L. That's the right thing. Has been asked many times in MCA exam. C1 to L1. And if you're interested, it is up to the lower border. It's up to the lower border of L1. And remember, this will be in the adults like you and me. Okay. In adults like you and me, our spinal cord is extending from C1 to L1. But in one of the exams they have asked in neonates, in infants it will be from C1 to L3, L3 upper border of L3, and this will be in neonates. So first important thing to remember कि spinal cord कहाँ से कहाँ तक होता है, C1 to L1 in adults and C1 to L3 in the neonates. चलो, one MCQ solved. Question number 2, what is the length of the spinal cord? Length of the spinal cord will be 45 centimeters in males, and it will be only 42 centimeters in females. Is it okay? Every time something less in females, even the spinal cord is less in females. Is it okay? Okay, someone is again confirming on the screen. Please remove that. Thank you. So it is 45 centimeters in the male and just 42 centimeters in the female. Okay? As given in Grey's Anatomy, nothing personal. Next one. Can anyone tell me what is the shape of the spinal cord? क्या होता है? Remember, the shape of the spinal cord will be cylindrical, like the pen that you are holding in your hand right now. Okay? So our pen here right now is cylindrical like this, है ना? So the shape of the spinal cord will be actually cylindrical like this. But guys, the problem, it is not uniformly cylindrical throughout the length. Throughout the complete length of the spinal cord, it is not uniformly cylindrical. What do you mean by that? If you see the complete length, 45 centimeters, it's not the same cylindrical shape. At two places, the spinal cord will be little bit